Cultural Competency Training. The purpose of this training course is to teach participants how to recognize the fundamental role of culture in the treatment process and expose cultural barriers that may exist between patients and providers. This training will explore how staff's cultural views create assumptions that impact treatment processes and how this can raise unnecessary hurdles in cross-cultural communication with others. This training will share strategies for responding to situations to reduce stereotypes in treatment. After reviewing this training, you will be able to know the importance of cultural competency, describe cultural competency and benefits, and be familiar with basic knowledge about major cultural and religious groups. Understanding the importance of cultural inclusion. Culture is the body of learned beliefs, traditions, principles, and guides for behavior that are commonly shared among members of a particular group. Culture serves as a roadmap for both perceiving and interacting with the world. Ethnicity refers to particular social groups in complex societies, groups that are differentiated not only on the basis of a range of shared cultural content, but also on the basis of social attitudes and economical and political considerations. Cultural competency in healthcare increases positive clinical outcomes in cross-cultural encounters with clients. Cultural dynamics can include, but are not limited to, language, norms, values, and sanctions. Measuring cultural competency organizational assessments. An organizational assessment is a systematic process for obtaining information about the performance of an organization and the factors that affect the organization's abilities to meet future objectives. An effective organizational assessment will highlight any gaps in an organization's workforce skills, enabling the organization to plan a training or recruitment program. The following are tools used to assess organizational cultural competencies: employee self-assessments, employee surveys, client surveys, community and other stakeholder surveys. Cultural competency brings together cultural knowledge, cultural awareness, and cultural sensitivity. It acknowledges and validates who people are. It also adds operational effectiveness to organizations. A culturally competent organization brings in the attitudes and policies which come together in a system, agency, or amongst professionals to work effectively in a cross-cultural situation. Cultural competencies involve the understanding and respecting person-served beliefs, cultural values, and practices. Principles of cultural competencies include fostering secure, respectful, and reciprocal relationships, partnerships, high expectations, and equity and respect for diversity. 4 features of cultural competencies include awareness, attitude, knowledge, and skills. When organizations take a cultural competency approach to diversity education, it enhances the ability of the staff to consider all 4 components for a more culturally competent workforce. Cultural destructiveness is the dehumanization of specific cultures or individuals, signifying an underlying bias towards the superiority of the dominant or majority group. There is an intention to ignore issues affecting minorities and promote policies and standards that have an adverse impact on them. Cultural incapacity is the inability to work with diverse populations. There is not an intention to ignore issues or promote policies or standards that have an adverse impact on minorities. Instead, their practices are based on a lack of understanding and ignorance. Cultural blindness are the approaches used for and by the majority that are perceived as relevant for all others. Practices are adopted for the greater good, which is generally the majority perspective. This level is characterized by inability to examine or even recognize existing biases in approaches, practices, education, and research, and it perpetuates the continued existence and development of models that can support stereotypes of diverse populations and further promote injustice. Cultural sensitivity is knowing the difference that exists between cultures but not assigning values to those differences. Cultural sensitivity can be challenging, especially if a custom or belief in question goes against the idea of multiculturalism. Cultural proficiency is demonstrated by the centrality of the organization's commitment to diversity and by its external expertise, leadership, and proactive advocacy in promoting appropriate care for diverse populations. Cultural competency is demonstrated commitment to work effectively across cultures in a way that acknowledges and respects the culture of the person or organization being served. Things that can shape culture include response of the majority to culture, political values, socioeconomic factors, degree of opposition to matriculation, and rituals. Cultural variables include race, ethnicity, gender, sexual orientation, social status, and more. There are many factors that can affect cross-cultural interactions. Organizations and staff planning to interact with varying cultures. When acknowledging cultures, the client is more likely to communicate freely and honestly. It increases diversity and minority workplace pipelines. It improves healthcare outcomes and quality of care, and creates opportunities to deliver culturally competent services. It will increase the ability to engage persons served about their health needs and how to address them, and reduces administrative and linguistic barriers to the care of persons served. How multicultural competent are you? At the beginning of this training module, you learned about cultural competency. Now you're being introduced to the importance of multicultural competency. Multicultural competency is defined as having the ability to engage in dialogue that are inherent to teaching about diversity. It means more than just racial inclusion. Multicultural competency is defined as having the ability to engage in a dialogue that is inherent to teaching about diversity. It means more than just racial inclusion. There is a difference between cultural competency and cultural awareness. Cultural competency refers to one's ability to interact effectively with people from different backgrounds and cultures. Cultural awareness is awareness of one's own attitude toward cultural differences and one's own culture. Knowledge and sensitivity are also different cultural practices. There are benefits of cultural competency in the workplace. It increases community relations. It increases the ability to communicate effectively with persons served and other stakeholders. It increases understanding of the need, wants, and desires of persons served, and increases in high morale for persons served and staff. It also allows the staff to have a different perspective when working with or providing services to people from different backgrounds and cultures. It helps people become more accustomed to hearing and having new ideas and perspectives. Culturally competent workplaces help employees overcome fear of mistakes, competition, or conflict. For example, by understanding and accepting many cultures, everyone involved is more likely to feel more comfortable and less likely to question if they are appropriate in terms of being used and behaviors exhibited. Culturally competent providers provide inclusion and equality, build on strengths and resources, and are able to easily identify barriers to work with other cultures or diverse backgrounds. Find out each person's served cultural background, understand your own cultural identity, recognize that culture extends beyond skin color, and recognize that culture extends beyond religion or sexual preference. Make persons feel at ease, elicit persons served expectations and preferences. Be open-minded and respectful towards beliefs, values, and practices to help persons served feel more comfortable. Consider factors that may be different from person to person. And consider some people may belong to more than one ethnic group. You must consider how different cultures may have different ideas about how to express and respond to pain. Consider how different cultures have different views on when to speak to professional health and by who. Cultural competency is a continuum, beginning with cultural destructiveness, continuing to cultural incapacity, then cultural blindness, cultural pre-competency, cultural competency, and cultural proficiency. Cultural competencies involve understanding and respecting the person's served cultural values, beliefs, and practices. Having some basic knowledge about major cultural and religious groups can be important to treatment and knowing your own culture. Bridging the gap includes recognizing cultural differences, recognizing individual differences, being aware of your own behavior and biases, using multicultural vocabulary with terms and phrases that describe cultural relationships as they should be, and showing respect. It is important to have culture-specific information about groups you care and work with. Staff should always take into account that every person is unique, even if from the same ethnic group or background. Knowing the cultural characteristics of persons served. Know the population you serve. Things you should know. What cultures are predominantly represented in your program? What are the values, beliefs, and traditional concepts to patients? What is the patient's perception of health and illness? In some cultures, certain behaviors can be seen as offensive and may not be reciprocated, including staring, direct eye contact, handshakes, and asking direct questions. When conveying respect, you're able to build rapport and trust. You acknowledge non-traditional living situations. You're able to watch for verbal and nonverbal cues, allowing the client to ask questions at frequent intervals. You do not ask about immigration status, and you provide appropriate health education. For example, African Americans classify illness according to natural or unnatural, often combine practical, magical, and religious beliefs. Illness may be viewed as an attack on the body, and they may seek traditional healers instead of or in addition to biomedical help, whereas the Chinese may be reluctant to seek physician care. Religion is central to their beliefs, and individual concerns are less important than what is best for the whole community or family. It is impossible to know all of the rules about each specific ethnic group. However, when treating a patient from a different background or culture, it is more effective to investigate and check out your assumptions rather than operate on incorrect predictions. For South Asians, direct gaze between people of different status is avoided. Many adhere to politeness rules and will agree whether or not they understand and avoid the use of the word no. They may delay seeking medical help and respect authoritarianism of the physician, and to some the head is sacred and should not be touched. Whereas Ethiopians believe in indigenous magic or practice religious beliefs, they may use traditional cures by Western medicine. Many times physicians are expected to communicate with family members rather than the person served, where Hispanics often neglect to shake hands, considering it as an insult. Malaysians will seek different healers for different illnesses. Jamaicans often feel as though self-medication is most useful. Navajos value silence and tend to not question or confront others and avoid speaking of death, where the Vietnamese find direct eye contact to be disrespectful. Gypsies do not like being alone, and they may be expected to consult with other relatives in treatment decisions, and Koreans are often impressed by diagnostic machinery. To bring it all together, pay attention to your body language, facial expressions, and other behavioral cues. Consider the smiles and laughters may indicate discomfort or embarrassment. Investigate what is causing confusion. Avoid yes or no questions, asking open-ended questions that may have multiple choices. Remember, greet the person served in language if at all possible. If there is a language barrier, assume there might be some confusion. Watch for signs. Question your assumptions about another person's behavior. They may not always be correct. Take your cues from the client regarding formality, distance, eye contact. Use gentle tones when communicating. Be open to including family members and other supports in discussions and meetings regarding treatment. and consider the best way to show respect by perhaps addressing the head of the family or group first.